Welcome back. 6:20 now. School can be an enjoyable time for some students, but for others, it can be a terrible experience, especially if they're being bullied. And with technology these days, bullying can occur in other ways besides verbal or physical. So what can we do as parents to make sure our child isn't being bullied or bullying others? Psychologist Dr. Krameelah Banks is here with some tips. Thanks so much for being here. What a great topic and issue at a great time, because a lot of people right now are getting ready for school. And maybe this is a good segment to come over and bring your kids and kind of talk a little bit about it after we get done with our interview. But I know that's one of the things you say, talk about it.
Absolutely. Talk about it, and try to talk about it very openly. If you find that a child is very reluctant to talk to you about it, you may want to try some strategies like paying attention to TV shows when they're on, and maybe if there is bullying behavior, maybe kind of introduce it and ask the child, well, what do you think about that? What would you do in that situation? Those are good ways to open doors to talk to children about it, because a lot of children may be fearful to notify you that they are being bullied. And we know that bullying is very common. Of course, the Pediatric Society says that 50% of children will be bullied by the time that they will leave school. So you're looking at half of the children that will experience that and may be very, very afraid to talk about it.
And you were a teacher before you became a psychologist, so
well,
you saw some
preschool
of this?
Preschool teacher. Bullying at the preschool level is not as prevalent. Typically, it's going to rise between the grades of 5th grade through 10th grade is when you see a very high prevalence of bullying.
And
so
as they start to progress into middle school, that's when parents really need to take note and watch for it.
Absolutely. I do have a specialty in school psychology, though. My specialty was in school psychology, therefore a lot of my experiences are with the school, so I still have witnessed myself a lot of bullying. And one of the things is that a lot of times we see it as just typical children behavior.
Right.
And that's one of the things that I want to express to parents as well as all viewers today, to not take it lightly. If a child comes to you and says that they are being bullied, then it's something that we should take very seriously.
Because there are some serious emotional effects of bullying. Talk a little bit about that.
Absolutely, absolutely. The emotional effects can be lifelong as well. You typically get children who may experience a lot of anxiety. Depression is one of the signs and symptoms, of course, of bullying behavior. You get those children who may be withdrawn. They may have really low self-esteem because they may feel like, you know, they're isolative or they're the only one that's going through that. So it has some really detrimental effects on children. And like I said, sometimes it even ends in fatalities. One of the things that we know is that suicide has been linked to a lot of bullying behavior. A lot of the times when children commit suicide, you can link back to some bullying behaviors that occurred. So it's something that should be not taken lightly, and we should be very proactive in trying to assist those students who are not only victims but who are also perpetrators.
And we could talk to you for much longer than what we had this morning. We'll have to bring you back throughout the school year to help parents and to be a reminder as well. Here's the information on Dr. Krameelah Banks' information there for her office. If you'd like to get in touch, if it's at a level that you need to call someone, then certainly do. She also has more information on related topics to mental health, or to find a psychologist. You can also visit the Arkansas Psychological Association website, which we have linked to ours at katv.com. Dr. Krameelah Banks, thanks so much for being here.